Hello, hi, it's Dr. Erica. Thank you for joining me on this particular video. I'm going to talk about two medications in a class of medications called the cyclovirs. The cyclovirs have two medications, the acyclovir and the valacyclovir. Valacyclovir turns into acyclovir once it's consumed and it's changed over in the body. So this particular class of medications called the cyclovirs is available prescription only, and they are utilized for patients who have the shingles rash and are looking for some sort of relief and some sort of eradication of symptoms. But I do encourage those people who do have the rash to take NSAIDs such as your Tylenol, your NSAIDs such as your ibuprofen, your Motrin, your naproxen as well. Also, aspirins can help with redness and inflaming pain. And then if you need to switch up with the Tylenol, that would be suffice as well to give your body a rest from taking NSAIDs, because there are some side effects with NSAIDs, and so I do recommend Tylenol to be interchanged. Now, the cyclovir class of medications are antivirals. They're prescription only, and they are usually covered by insurances, so you might receive a financial break from that. If not, then the cost will have to be on a prescription coupon from the manufacturer, or such as a GoodRx coupon that can help with that. So I do recommend seeking out coupons for better pricing, because most insurances do not cover for these particular medications. They only cover for preventative, such as the vaccination against the shingles. So you might receive some sort of coverage in that area. But the best way to find out is to check with your prescription insurance. Okay, so Valtrex is valacyclovir. Valacyclovir comes in two strengths, and the tablets are pretty large. A 1 gram tablet is what is recommended 3 times a day for about 7 days, with plenty and plenty of water. And it is recommended to take, again, 1 gram 3 times a day with plenty and plenty of water. Okay. And it's best to take this 1 gram dosing as soon as symptoms begin to present, such as the rash. The rash could be anywhere. I've had patients to come in and say they've experienced rash along their neckline, the facial features, the abdominal, the back, shoulder, down on the legs, near the ankles. So it just depends on the individual and their situation. So some patients may experience large rashes. Some patients may experience smaller rashes. It just depends, again, on the individual and what they're dealing with at that particular time. Also, acyclovir, the brand name for acyclovir is called Zovirax, and it's in the description box as well, so you can take a look at it. It comes as an 800 milligram tablet, and it's dosed 5 times a day for 7 to 10 days to help with the painful rash and eradication. And it's recommended to take with 8 ounces of water, or as much as water as possible with each dosing, to help with flushing and things like that. The medications of the cyclovir family, the two are also used for other herpes zoster, shingles, as well as cold sores that may develop as well. So if you're dealing with the cold sore, these medications will be very much indicated, and also a good choice. Okay. Um, Now, acyclovir has other indications with it as well. It's more used often in hospital settings for patients who are dealing with immunocompromised patients who may be dealing with other infections. So acyclovir comes in ointments, creams, as well as injectable forms, suspension capsules as well. But usually for shingles rash, you're going to see a prescription for the Valtrex or Valacyclovir. So again, that's going to be your 1 gram tablet. That's very large and to be taken 3 times a day by mouth with plenty and plenty of liquids, plenty of water as well. So I do recommend reading your actual prescription handout. Do read those as they come with the prescription. Ask plenty of questions to your pharmacist as well if you have those questions. And I always recommend vaccinations. So there's no studies that say that you can't get the vaccine after the rash. I have personally seen patients who've had the rash to come in and get the shot anyways, um, for I guess record's sake. So it does not have the indication for that particular population, only for those who have um, a history of chickenpox or varicella virus chickenpox, and those patients who are now 50 years of age and older, and those patients, they don't have to have record of having the chickenpox as a child, only if they may or may not remember. But we always recommend, if you're 50 years of age and older, go ahead and get your shingles shot, just because we want to make sure you are covered and you will not have to deal with this painful symptom of rash. So that is the reason why we always suggest that patients get all immunizations and be up to date completely and totally for full coverage. So that's all I have for this particular video. Please subscribe and also share with your neighbors and loved ones that are in their age range and qualify for this particular shingles vaccine, as well as those who may be dealing with the shingles rash. They can also get the vaccine and get the tablets for treatment as well. There's no contraindication against getting the vaccine after receiving the rash. So again, I've seen it done personally in retail pharmacy. I've been a pharmacist for close to 10 years, and so I've seen a lot of the alternative and off-labeled indication therapies that do take place in medical field. So I do encourage that. And if you have any questions or comments, please let me know. And any topic discussions, I'll be happy to go over those as well. Thank you, and don't forget to subscribe. Have a great evening. Bye-bye.